My name's Peggy Shannon with Dental Studio 101, one of the hygienists there, and I'm going to give you your hygiene tip for the month. And this month we're going to talk about your routine brushings that you should be doing every day, and I'll give you a little insight on extra things to do while you're brushing. Pardon me if I skip around a little bit. First off, brushing should be done twice a day, at least. And there's a variety of things that we want to use when you brush. You don't just brush your teeth, but you need to brush, floss, rinse. You can use we only hand out soft or extra soft toothbrushes. We also recommend that you use an electric toothbrush. We do tend to push the Sonicare. It's one of our favorites. So there's a variety of things that you need to do. We don't just eat broccoli because it's good for us. We do a variety of food to stay healthy. We do a variety of exercise to stay healthy. If you do a variety of stimulations to your tissue, not only keeps your tissue healthy, but when you have healthy tissue, you also have healthy bone. So we'll start with, like I said, with the toothbrush. When you go to brush your teeth, we do it twice a day. Variety. Use one manual toothbrush, use your electric toothbrush once a day. If you don't have both of those, you can dry brush with your manual toothbrush. Dry brushing removes more plaque than a wet brush. So don't be afraid not to use, toothpaste or water. When you're brushing, you want to angle the toothbrush at a 45-degree angle towards the gum line. And it's okay to make a small motion, but we don't want to rub back and forth. When you're rubbing back and forth, you can also wear away your tissue. And to keep in mind with your little circles, your tissue on the top draws little M's, as in McDonald's, if you will. On the bottom, we do little circular motions, as in a W, Wendy's. So we're doing McDonald's on the top, Wendy's on the bottom. Okay? If you are an aggressive toothbrusher and you scrub really hard, you might want to think about lifting a few fingers. And what that will do is lighten up your touch, okay, so that you are not wearing away your tissue. And you just spend more time to treat each tooth as an individual, and that's the way that you'll work your way around your mouth. When one tooth is clean, you move to the next. When the next one's clean, you move on. Let's see. When you're all done brushing, you want to make sure you do the outside of the teeth, you do the biting surface of the tooth, and you do the insides of the teeth. So 3 areas all the way around. Light and long is the secret to brushing. When you're done brushing, you might want to think about flossing. Once a day we want to floss. When we floss, we want to wrap the floss around your middle fingers. When you wrap it around the middle fingers, you can reach with your index finger. Some people that wrap it around the index fingers, you're then trying to put your full fist in your mouth. When you're done brushing and flossing, one last thing that you want to do is brush your tongue. Your tongue is the roughest surface in your mouth. It does collect the plaque. When you're done brushing, what do? You go, and you bow that plaque right back on your teeth again. So we use either a tongue scraper and scrape your tongue, or you use just your toothbrush and brush it. If you're using the electric, you might want to turn it off before you brush your tongue, just for more comfort, and so that you're not ripping your tongue apart. So, if there are any more, I wish I could say if there were any questions, I would answer them, but this is your monthly tip for the day.